Our dear viewers, welcome to a new episode. Please click the subscribe button to encourage us to publish more medical information. Anemia is the most common blood disorder which develops due to decreased number of red blood cells, RBCs. Diminished RBCs leads to decreased hemoglobin content, which is responsible for transport of oxygen and nutrients to be delivered to all body cells. So, we can assume that anemia leads to decreased body tissues oxygenation, which is mainly manifested with persistent fatigue and shortness of breathing. There are many forms of anemia, each of which has specific clinical picture and management plan. Also, anemia could be a sign for more serious health problems. Anyway, the common clinical signs of all forms of anemia include the following: persistent fatigue, shortness of breathing, headache, dizziness, palpitation, pale yellow skin, brittle nails, hair loss, cold extremities, generalized body ache, poor growth for children and adolescents. For proper management of anemia, it's important to identify the causative factor. Causes of anemia include the following. 1. Blood loss. There are many health problems associated with continuous blood loss and development of anemia, such as gastrointestinal ulcers, hemorrhoids, certain types of cancerous lesions and menstrual disorders in women, for example, menorrhagia or polymenorrhea. Also, blood loss may occur post-operative or after exposure to trauma, as in accidents. 2. Iron deficiency. The human body needs iron for production of hemoglobin. So, decreased intake of iron or increased demand of iron leads to iron deficiency anemia. Main predisposing factors of iron deficiency anemia include low iron content in diet, excessive intake of caffeine, decreased absorption of iron from the intestine as in Crohn's disease as well as during pregnancy and lactation. 3. Vitamin B12 deficiency. Vitamin B12 is necessary for production of new RBCs. So, decreased intake of vitamin B12 results in anemia. Main causes of vitamin B12 deficiency include the following: decreased intake of animal proteins and improper intestinal absorption of vitamin B12, as in cases of ulcerative colitis or inflammatory bowel disease. 4. Chronic health problems. Anemia may develop as one of the associated complications of many chronic health problems, such as renal failure, hypothyroidism, cancer, diabetes, liver failure, as well as immunological diseases such as rheumatoid arthritis and systemic lupus. 5. Improper or diminished production of new red blood cells. It develops as a result of many health problems, such as aplastic anemia, thalassemia and lead poisoning. 6. Sickle cell anemia. It's a genetic disorder caused by abnormal morphology of RBCs, crescent-shaped. This leads to RBCs breakdown and blood hemolysis. So, the end result is decreased tissue oxygenation and development of acute anemia. Lab diagnosis of anemia is achieved by complete blood count test, CBC, which measures levels of red blood cells, hemoglobin, hematocrit value and other blood components. Also, the doctor will ask the patient about his personal history, family history and current symptoms for identifying the cause. Treatment of anemia is achieved depending on the causative factor. For example, in cases of anemia caused by iron deficiency or blood loss, iron supplementation is the drug of choice. In cases of anemia caused by vitamin B12 deficiency, vitamin B12 supplementation is highly recommended. In cases of aplastic anemia, the case is usually managed by medications and blood transfusion. If these measures failed, bone marrow transplant is done. Support the channel to encourage us to publish more.